over all of my instruments.
Okay.
Okay?
All right.
And I'm going to take the stuff that's going to be spread across the patient, and I'm going to put it up here. All right? So now, my back table is ready to go, and I am ready to go. Okay? I might even at this point have my suture loaded and just sitting here like this so that it's ready to go. Okay? I have my, I'm going to just pretend. Okay? So I have 30 cc's. Typically it comes in 30 cc vials. So I have 30 cc's of whatever my local is going to be. I'm going to take my syringe. I'm going to load it up to 10. Always load it up to 10. Never load it less than 10 unless the surgeon specifies it. Because at the end of the case, you're going to be asked, how much local did you use? If you're just arbitrarily loading it to more than 10, you don't know how much you have. You don't know how much you're using. So you load it to 10. And you have it, depending upon your case.
Now, do you stick a label
ready
on
to
it?
go.
Right on it?
Absolutely.
Okay.
What we're going to do, and we haven't done that yet, is we're going to label absolutely every fluid on my field. Okay? So, this is going to be, some places will give you labels like this, which is very nice. I am not going to teach you how to use those yet. I'm going to teach you how to use the blank ones first, okay? So my circulator comes up to me, and she shows me my vial before she pours my medication. And she says, 1% lidocaine with epinephrine, okay? And she pours it, and I look at it, and I say, okay, 1% epi, 1% lidocaine with epi, expiration date, 2013, December 7th. Okay, you always say the expiration date out loud, you always say the medication out loud, and she will confirm it. She will then pour it in, or he will then pour it in, unless you're drawing it up, which is another story right now. Okay, so I know my medication is 1% lidocaine with epi. Okay, so I'm going to write out a label for 1% lidocaine with epi. Does everybody know what this sign means?
With.
A C with a line over it means with.
With, yeah.
Okay, I'm going to take this. I'm going to put it on my med. I'm not going to put it on my numbers. Okay, on my cc's. What are they? Cc's or milligrams? How are these measured? Cc's. Okay, cc's. Okay, so I'm going to put it on my syringe. Then I'm also going to take it and I'm going to put it onto here.
Oh, okay.
Where?
A cup.
Onto my med cup.
Okay.
Okay, because I might have more than one medication on that field. All right? Now, this is going to be brown. I know it's going to be my betadine. But for argument's sake, I'm going to write down, I'm going to pretend this is blank, okay? Betadine. I want to see every single liquid on your field labeled.
Okay.
Every single liquid. That's saline, okay? So it's NaCl, or saline. I always write NaCl. I know it's NaCl. I know it has no bacitracin in it. I know it has nothing in it because I saw her pour it. NaCl, okay? So every single liquid on my back field is labeled right now. All right. And this, well, I'll just take and stick under here. Leave it, well, this I'll put here. So it's right. Oh, always have your pen on your Mayo stand because he's going to mark the site. Alrighty? So this is ready to go. So your surgeon comes in, okay? Come here, surgeon. It's here.
And this gets handed to the circulator? Or?
Just turn it and just hand it to the circulator.
Okay.
No, it's the right hand.
Oh, the thumb's backwards.
Go ahead.
The thumb is backwards.
No, it's not good.
Oh, yeah, it was backwards. Whatever.
It was backwards.
Yeah, it was. Yeah, like my thumb's over here.
It's really bizarre.
It's still not gonna go perfect because they're so big, but and I can't touch it. But whatever, yeah. Once I get my other hand in there, I will.
The other way? Right.
Okay, now I can touch them. It's horrifying.
Hold that.
Hold which,
That.
this?
Turn around. Actors are helpless.
Oh yeah, they are.
All right, now this one I can keep.
Okay, because you
Okay,
touched it.
this one I can keep because I touched it. And if I want to use this to write something on, I can. The problem with that is that according to AST and KHEP standards, once this is on your field, you cannot take it out of the OR.
Really?
Because it will have
Okay.
patient bioburden
Oh.
on it. So
Okay.
what I would recommend doing is you can keep this, okay? You can write on this. If you want to write something down, then transfer it to your book. Keep a little book with you and transfer it to your book. Then you can throw this out. Because if it's on your back table and it's in the middle of a case, it's bioburden. It cannot be taken out of the OR. Okay? So, then we do this. So close. All right, so now my surgeon's going to prep. Okay? There you go, surgeon. Prep.
Okay.
Remember, you start from
The center.
the center,
and work
hold
my
it straight
way.
like this.
This way? Oh,
Okay?
this way.
You start from the point of incision, so that's going to be the incision.
Okay.
Okay, so
This way.
over it, and then around it, and around it.
Okay.
You never go over it,
Alright.
okay? And then you take that, and you're not going to give it back to me. You're going to take it and hand it to your circulator.
Okay.
Okay, but your circulator is going to be very careful that she doesn't touch your hand.
Okay.
Okay, and I'm going to give you this again. Technically, I would have dumped it into here, right?
Okay, yep.
Okay. Round, all the way around. And then this goes to the circulator, too.
Okay.
Betadine comes off your field.
Okay.
Why does the betadine come off your
Now it's
field?
good.
So you're going to play scrub right now, okay? So
Okay.
you're going to come over here.
Lovely gloves.
I know. And you're going to take those,
Okay.
and you're going to hand them to me so that I can drape the patient. I'm going to come to your side, okay, because you don't want to reach over anything. Finger goes in, and you hand it. Okay, so I'm going to take it. I'm going to always drape closest to me because I'm creating a sterile field. Okay? See how I had it folded so when she handed it to me? And I'll show you how to fold them again. Okay? Yep. Or
As
not.
it sticks to my glove and
As it
rips
sticks to your glove.
Hello.
This is why we don't wear gloves bigger than what we're supposed to wear, by the way. We always wear gloves that are the right size. Yes, don't touch anything. Okay? Go and get me another set of gloves for her, please. Okay?
That
And
was
you're all
just
going to
funny
have
'cause
to
it was
learn
like-
this.
Okay.
I'm thinking of being all good, handing you the right instrument, and then it sticks to my glove and rips it.
That works.
Okay? So, your glove is ripped. The circulator's going to hand the scrub another set of gloves. Scrub's going to open the glove up, have it ready to go. Your circulator is going to come, or you're going to head over to your circulator without touching or contaminating anything, okay? And your circulator is going to grab your glove by the cuff.
Okay.
See how I'm taking it through the cuff?
Mhm.
And I'm going to pull it off.
Okay.
Okay, now,
Oh,
don't put
leave
your
it in.
hand through.
Okay.
Okay? Now,
I don't wanna touch my
if you
face,
were
though.
gloving yourself, go ahead, glove yourself.
Oh, okay, alright.
You have one sterile hand already, so use one hand.
Okay.
Thumb to thumb. That's wrong, right? Because you touched the... Oh, I hate when that happens. Now, always clamp it down one so you don't close it on yourself like you did before. Okay, just one. You had it down a bunch. Just one. Okay?
Now, the surgeon is not doing this, though.
Oh, yes, he
Oh,
is.
he is.
Oh,
Alright,
sure,
okay.
you're not doing this.
Alright.
I'm the surgeon right now.
Okay.
Okay? So you're going to take the drape.
Okay.
That's the drape.
Yeah, I can touch it anywhere, though.
Of course.
Okay, because I'm...
Oh, yeah, you're sterile. You can touch
Okay.
anything. Take a look at the drape.
Okay. So
Okay.
midline. So
Pay
we get.
attention to how it goes, how the patient goes. Okay, so you're going to go on one side. You're not going to do anything yet.
Okay.
All right, you're going to go around to the other side.
Okay.
Actually, what you're going to do, okay, you're not going to let it drop. You're going to open it,
Okay.
okay, and then, actually, I'm not going to do it now.
Yeah, just leave it like
Okay,
that.
let's just fold it back up,
Okay.
because I want you guys to do it when you're going to do it.
Okay.
Okay, so we have the drape on the patient. Okay, the drape is all on the patient. Anesthesia's hooked up. It's up. It's down. Then you're going to come over here
My whole thing is my back stand behind you, like.
over the patient. The reason I did this is because some surgeons will help you out. You can just take this and put it here. Okay, and then the surgeons will be good enough to do this.
Of course, they don't fit.
Yeah, they don't fit. They never do.
Okay, so what we're going to do is we're going to put tape around those so that
Alright.
they do fit. All right, then this comes off.
Mm-hmm.
And this is the very first thing
I
you
don't know.
guys
There's
are going
more.
to be
There's
doing.
different ones over there.
This is the very first thing you guys are going to be doing. The very, 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 very first thing is you're going to get your suction and your bovie set up.
Okay.
Okay?
Where does like this go? Does this go back in your back stand?
I'll show you.
The
where
back
it goes.
table rather?
I'll show you where it
All
goes.
right.
Okay? All right, we're assuming there's a big drape on this patient and everything's
Okay.
sterile. This one is broken. I like to hang them right here.
Oh, okay. All right.
Okay, that's where I would put mine, or I would clamp it to the drape. And when you guys do it, when we open up the drapes, which we're going to do next after you set it up, I will show you how to clamp it on there. Okay.
Okay.
So now everything is ready to go except for one thing. Take my back table and I'm going to put it here. Alrighty. So now everything is accessible to me.
Okay.
The only thing is that I didn't pay attention to whether it was going to be a right-sided hernia or a left-sided hernia.
Well, if it
My
is
instruments
left,
are all
then you
set
have
up
to come on this
back
side.
backwards.
Okay.
Okay, so what I'm just going to do... Oh, this has to get hooked up on here. Very important, okay? Is I'm going to just move my instruments over a little bit. I'm just going to slide them down because we like to have the instruments closest to the surgeon. In the order he's going to use them, right? So this is the order the surgeon's going to use them. I'm also going to take the first three things I'm going to do after that patient is draped. The very first three things I'm going to do is I'm going to hook this up, I'm going to hook this up, I'm going to take two Ratex, and I'm going to put them on either side of that fenestration. What's the fenestration?
Opener?
The opening of the drape, right? Okay? This way, he can get started. If I have something I have to do back here, if another surgeon's coming in, and I have to gown and glove another surgeon, he can get started. So the first thing he's going to want to do is, have a pen please, marker, he's going to mark. Then he's going to take the 10 blade, which is the skin blade. Then he's going to take the 15 blade. Then he's going to take the tooth forceps.
Now, are you this close to him?
I am like this. If I'm the only person here, I am right here.
He's on this side.
Yep, and I'm here.
Okay.
But if you're working on that side, then you would be over.
Correct.
Because that's where we prep the patient.
So would you move the back table all the way around?
Correct.
Okay.
Yes. If I was working on that side, I would move everything all the way around.
Okay.
All right.
Okay? Let's just assume then for argument's sake, we prep the patient over here, okay?
Yeah.
I only do that because it's got that little colostomy hole there.
Yeah.
So I utilize that as our suture area. But let's pretend that, all right, the surgeon's over here, I'm over here, I'm across from him, I'm ready to go, okay? He's made his incision, he's going to use his tooth forceps, then we're working, we're cutting down, we've cut down, I've helped him retract, or I'm gowning the surgeon that's going to assist him, and I'm just going to move myself down a little bit. I'm going to stay here, and the surgeon's going to come here, and they're going to work, and I'm going to be sitting here giving him the things that he wants, okay? Which is what we're going to be doing.
Now, if another surgeon came in and you had to gown another surgeon, will he just take the things right off your mask?
Yes.
Okay.
He'll take what he needs.
All right.
You know, that's not a problem.
Okay.
Or sometimes the surgeon will just gown himself and
Okay.
glove himself. That doesn't happen too often, but some will.
Okay.
Okay. Then, obviously, after we have retracted, right? We're going to take our meds. We're going to cut. Okay. We might clamp and retract, clamp and retract. Okay. I typically put this on a long Kelly. Some places will put it on a tonsil, and I just leave it up here like that so it's ready to go. So if he needs it, it's ready to go into his hand, okay? I always do a back flip, but that's my thing. Some people don't. I do a back flip. It's just easier for me. Alright, so everything is here. If he needs a Babcock, there's my Babcock. I know exactly where it is. I don't have to go fartsing in here for anything unless he asks me for something specific. Okay? Everybody got that? Here? Now,
Now, once he uses it,